Okay, we're on with our first attendees of the conference. We've got Sandy, John from Seattle Children's, and Kelsey Montgomery from Riley Children's Hospital. Thanks for coming and joining us on the podcast.
Thanks so much for being here.
Oh, my pleasure. Our pleasure. So, you're both on the CDH Focus Group, is that right? Well, tell us a little bit about how that experience has been for you as like a participant on one of the focus groups.
It's been incredible. CDH, it doesn't feel rare. Like I'm trained with Diana at CHOP and it feels like the most common thing ever because we see a lot of it there, but it's a relatively rare condition. But with the CHNC, it's incredible because we get to partner with people from around the country. And not only do we have research projects and a consensus guideline projects, but if we have a really difficult patient, we email our focus group, and within minutes, there are so many responses with advice on how to treat patients that are really sick, relatively rare,
Quickly.
and quickly. Yeah, so it's an incredible collaboration.
Yeah, that's neat. Kind of, I mean, you guys are doing this ongoing collaborative work, but having that just in time, that case review network is really important too. I love that. I love that. So, what is the CDH focus group focusing on?
Well, we have a lot of topics right now. But one thing actually that Sandy's doing is we're looking at bival. Well, I guess that's with our ECMO group as well.
But similar
But
patient.
similar patient population. And so looking at throughout the country, each of these hospitals, usually people have used heparin for abdominals, and we're switching over to more bivalirudin as an anticoagulant. And we're kind of in uncharted territory, right? So we're looking at, does this actually decrease the risk of complications on ECMO? So it's a really powerful work, and Sandy's been doing awesome with that. So it's been great to be a part of that.
Oh, I'm so excited for that data. I know that it's definitely something that's changing our field and going to help us with data.
For sure. Because I think what the data that currently exists on this topic, it's not so clear that everyone should be using bivalirudin, but in a way, the field is already moving on and more centers are switching to it. But the way that we're currently getting these guidelines is you just email a friend and piece together your protocol with your own review of the literature. But I think we can do so much better. So we're collaborating to create consensus guidelines and doing a systematic review of all the literature, not only just for babies, because there's so little out there, but babies, pediatrics, adults. We're going to look at what the literature offers and then fill in the gaps with what's missing with expert consensus guidelines. And hopefully then we can make our practice universal, which will then make research so much more high quality.
Yeah, and that concept of not everybody not reinventing the wheel, who've already got something good. For people who aren't familiar, what is the rationale between kind of this shift?
So heparin has been the anticoagulant of choice for decades, and more people are switching to bival, mainly based on anecdotal and some retrospective data that it can lead to decreased bleeding and clotting complications. It's faster on and off. But there are a lot of things that we need to study more, such as how best to titrate it, what doses to use. All of that right now is very um, uh,
Right for investigation.
right for investigation, uncharted territory. Different centers are doing different things. But anecdotally, for example, at a center that uses heparin, you can repair a CDH on ECMO, and maybe you'll need to use an antifibrinolytic like Amicar. But with bival, we have not needed to do that. Our sockets have been lasting longer. But again, we need to do more than just this anecdotal thing that I'm saying and study it more rigorously.
I love that. Tell us, each of you, what is there anything you're looking forward to in particular at this meeting this year?
So I'm really excited to go. Yesterday, I was at the hemodynamics session, and it was awesome. It was great review, and we had expert speakers on all these different topics. It was really wonderful. There's a lot of energy with this. And then also looking at incorporating a new hemodynamics program at your center. So that was really helpful. But actually this afternoon, really excited about the POCUS workshop, which Sandy is also doing. So now you see why I brought her. But really excited about this. It's just great to kind of be meeting of the minds with all these different big level 4 centers and see what's working and how do we improve and get better with our care for patients.
Yeah. Love that. What are you looking forward to?
I am excited for everything. I feel like because at PAS, you pick and choose your neonatal, but here literally everything is relevant. So I'm really excited to meet people that we only see on Zoom, like Kelsey here, and just learn a lot.
Perfect. All right. Well, we'll be seeing you. We'll be looking for some of that new data as it rolls out. And thank you both for joining us.
Thank you so much. Thanks.